Violence against women is a universal problem and a violation of basic human rights. Studies show that 1 out of every 3 women has been beaten, coerced into sex, or abused in her lifetime. Building on years of groundwork, Sehat in the year 2006 developed a 9-day course on violence against women and the role of healthcare providers. In 2018, they embarked on a project using a 3-day version of the course to equip health professionals in public hospitals with the tools to identify and address various forms of intimate partner violence against women and its health consequences.
Different strategies were adopted for this project, which include understanding the barriers faced by the health system in responding, then building the capacity of the healthcare providers, and developing the protocols of care for women facing violence.
Previously, if the patient is coming repeatedly and she is not having any organic disease, I usually ask her to change the doctor. Like this was my attitude considering the overload of the work or load of the work. This is not our overload because attitude matters. This sensitization has worked a lot. Now I try to give her privacy and confidentiality and ask what is the real problem behind that.
For example, a woman repeatedly coming with abortions or for abortions or with repeated pregnancies. So in such cases, usually we used to scold, but now after training, they understand that she might be a victim of sexual violence and that's why she is repeatedly coming with this.
There has been a remarkable change in their clinical practice as far as the responding to violence against women has been concerned, and they have been able to document it as a part and parcel of their routine clinical practice.
One patient I remember, she came in the hospital as a medico-legal case. She was having many injuries on her body. So after asking history, she only told की मी गाडीत बसले होते आणि गाडीचा दरवाजा उघडला आणि मी खाली पडले. नंतर विचारल्यावर कळलं की नवऱ्याने तिला ढकलून दिलं होतं गाडीतनं and she don't want to file a case. So I counseled her. I told her that okay, you don't want to leave your husband, but make some arrangement of safety.
When we are doing emergency, at that time in the midnight 2 o'clock, a woman turned to us with excessive profuse bleeding PV. We thought it may be a case of abortion, but when we examined her, we found that it was a big postcoital tear. So we used to suture it and we sent the patient home. But when I was gender sensitive and I undergone the domestic violence training, then I have sensitively probed her that what is the cause for this bleeding. And then after 2 to 3 days when she was under treatment, she has seen our approach and then she gradually said that the tear which has occurred, postcoital tear, means it was a forceful sexual intercourse. So it is within the marriage only, but it was a forceful sexual intercourse. And then we counseled her husband, we have given her support, and now that patient is having a regular follow-up and they are living a very happy and married life.
I'm not spending even 1 minute extra than what I was doing before, but the quality of service that I'm providing has improved dramatically. So I would tell the administrators that maybe you call our people over to tell you that this is absolutely, quality addition without any taking away any of your time, and you're going to feel good and you're going to contribute to the society. And if we can't do that, finally, in a medical college, we have only 2 targets, the patient and the students. And this is a wonderful way where we are helping both, and the community at large is bound to get benefit.